Hey, welcome back, everybody. Time once again to see if we can't do something we call Health Simplified, a simple guide to a healthier life. From a guy who, well, he seems to know how to explain it simply, Dr. Justin Fessler. Welcome, sir.
Thanks, Paul. How's it going?
I'm always fascinated by this show because you get into some very technical things, but you do it in a way that I go, that makes sense. I kind of understand it. So who'd you bring along today here?
Well, today I'm going to introduce Stacey Roberts.
No relation to me. My name's Paul Roberts.
Correct.
That's okay.
She is a physical therapist with over 3 decades of clinical experience, having practiced since 1990 with a specialization in outpatient orthopedics and sports medicine. She holds impressive credentials as both a physical therapist and a master's trained registered nurse, bringing a unique dual perspective to patient care. From 2004 to 17, Stacey owned and operated a cash-based health and wellness clinic on Gold Coast of Australia, where she specialized in women's health and hormones. Currently, she operates New You Health and Wellness Clinic in Wauwatosa, Wisconsin, where she has integrated a SoftWave device into her practice as a cornerstone of treatment after recognizing its potential to move the needle in pain management. Stacey is recognized as a shockwave expert and educator who has trained professional sports teams from NBA, NFL, MLB, and NHL, as well as celebrities in the use of shockwave therapy. She's also an international speaker, podcaster, best-selling author of The Pain-Free Formula, Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections, and a business owner with a passion for helping patients achieve optimal health through innovative, non-invasive treatments. So Stacey, thank you for coming on. I really appreciate it.
Thanks, Justin. Thanks for having me. I really appreciate you.
I got to interrupt 1 second here. I told you guys I butt in once in a while. She's got to explain how she got from the Gold Coast of Australia, this beautiful place, to Wauwatosa, where I lived as a kid outside of Milwaukee here.
What?
That's a small world.
Yeah, really.
That is a small world. I was actually the most impressive thing about that introduction bio is that, Justin, you pronounced Wauwatosa correctly.
He looked a little panicky.
It was a guess. I was like, yeah.
That's really great. Well, if you're wanting to know, we moved to Australia in the year 2000, right before the Olympics, and my son was only about 2 years old. And then over time, I had a clinic there, help people, like we said, with hormone levels, things like that. And then just family getting older, too far away from aging parents and things like that, came back to the U.S. And started up my clinic here shortly after that.
Nice. Yeah. How was it being in Australia? Was that something you miss now, or?
I miss the weather since I'm in Milwaukee. On the Gold Coast especially, it was 355 days of sun.
Oh
right?
my gosh.
So, yeah, something crazy like that. So I definitely miss the weather, and certainly my friends over there that I made over the years are.
Yeah, sure.
It's tough to, see them, obviously, because it's so far away. So I've been back 1 or 2 times since then, but it was a great place for my son to grow up as well too.
Awesome. That's great. So maybe we'll start in with, maybe you can explain a little bit of, maybe the general term of shockwave therapy and kind of what that is, and maybe a few things that people might kind of cling on to as far as just an understanding of what it is and why we care about it.
Absolutely. It kind of sounds kind of scary when you just hear the word shockwave, but really basically shockwave is all around us. Anytime a lightning bolt strikes the ground, it creates a shockwave. Any explosion out there creates a shockwave. Volcanic eruption creates a shockwave. And what they found when the Hiroshima and Nagasaki bomb dropped, the shockwaves from that explosion affected human health in the human body in certain ways. And what they were able to gain from that terrible experience was the shockwave we could utilize shockwave in general for things like breaking up kidney stones. So that kind of flashlight effect of that explosive shockwave they made into more like a laser effect to point at kidney stones and create a bunch of energy within that kidney stone, so that could be burst into millions of pieces and either passed through the patient or reabsorbed in the patient's system, so they wouldn't have to have surgery for kidney stones. So that's kind of where the high energy shockwave came from, and people would be put under anesthetic for those procedures because they wouldn't be able to stand being awake during them. So when they found that, when they were treating patients with the kidney stones, they found that the vertebrae, the bones in the spine behind the around the kidneys, were starting to become more dense or thicker. So they thought, that's interesting. I wonder if we could utilize this for bones in bone healing. So sure enough, they tried the high intensity shockwave therapy on bones that weren't healing. They were resistant to healing for months and months. And then that stimulation from the shockwave device started to restart the healing process for bones. So that was fascinating. And then somebody said, well, what can we do about with tendons and ligaments? You certainly couldn't use high intensity because we didn't want to create any damage. So they brought it down to low intensity. And there's now a few different types of shockwave devices on the market, low intensity, that you might see in a physical therapist's office, chiropractor's office, a physician's office, and obviously your office and mine too, Justin.
Yes. Yep. Yeah, I am a SoftWave provider too. So, and I've been using it the last year and a half, I think, and having some great results with patients and everything. So, and as far as, maybe the orthopedic type of shockwave that we're talking about, not the one for, blasting kidney stones. Maybe you can go into a little bit of the difference between, like SoftWave's version and maybe some of the other ones that people might find out there.
Sure. So there's different types of shockwave. One is called a radial pressure wave or radial shockwave. That one doesn't produce an actual shockwave. As the research expands, more and more people are starting to understand that. That one's more like if people think they have shockwave and they felt it was rather painful, it was kind of like jackhammer on the skin. That has some efficacy for tendinitises or anything that's on the surface, plantar fasciitis, that type of stuff. But it can be rather painful. I think, Justin, you have a radial device in your office.
I do, yeah. So we use it for some superficial things like you're talking about. Yeah.
Absolutely. So then there's true shockwave. There's different kinds out there. Those are most of those are all focused. Like, remember how I talked about the kidney stones where they focus the energy on one point? Most of the true shockwave devices out there still kind of come out like that laser beam. So the biggest difference, though, in those other true shockwave devices and SoftWave, which is a true shockwave device, is SoftWave comes out like a flashlight. So it's kind of like more of that natural shockwave in nature, where there's still a focal area in the middle where most of the energy is, but it's also treating the tissue around that area as well too. And the benefits of that are it's usually more comfortable for the patient as a result. It usually takes less shocks because you're treating a larger area, whereas you're trying to pinpoint on the spot with the focused only devices, you can kind of fall off those spots. So that's what requires it sometimes to have, or most times to have, more shocks. And SoftWave tends to be more comfortable because it has that width and depth aspect to it. So from an orthopedic standpoint, the treatments are rather, 5 to 12-minute treatments, typically, depending on what area you're using, and it gets the depth. So things like even pelvic floor, we can use it for getting deep into the hip or deep into the back or deep into some certain muscles in the body that are hard to get our hands on. Really helps bring blood flow to those muscles and they can relax, but it also helps with decreasing inflammation for those orthopedic injuries. And what's really cool, I find, is that like radial, sometimes it takes 2 or 3 weeks for the person to get a response. Patients usually walk out 50 to 100% better in the first treatment with SoftWave. And that can last for a couple hours to a few days, but then every treatment that they have after that, they should get expanded relief during that treatment protocol. So the advantage of it also with just PT alone is if you add SoftWave to that, you're going to usually decrease the number of sessions that the person needs by at least half, typically, if it's used correctly and with PT, functional exercise, hands-on therapy, things like that.
Yeah, I find that first session is really nice indicator if they respond really well. I always tell them it's kind of a transient improvement, but with subsequent treatments, you should keep improving. But that's just like an indicator of their potential outcome. So it's a nice way of showing them that, this will get better. It'll feel this good eventually once you've gone through all the treatment sessions.
Exactly.
But just, keeping it real that, this is a transient improvement when you have, just that first treatment. So, and then as far as maybe you can just go through maybe the top few, maybe contraindications that someone should know that, maybe if they're have certain things that they shouldn't have treated as well.
Yep. So each of the shockwave devices have their own contraindications, but the global contraindications based on the International Society for Medical Shockwave Therapy over in Europe are 3 simple, straightforward ones that make a lot of sense. We don't do it over a pregnant uterus. So even low back, that could be potentially over the uterus. We avoid that area if a woman's pregnant. She could have other areas of her body treated, just not over the pregnant uterus. Not over a known malignant tumor. So we don't want to do that at this point until there's more research to say whether that could be a good thing to utilize shockwave to treat that or not. So right now that's contraindication, and not over a pacemaker. So so that's the left shoulder for some people who are right-handed, others who are left-handed, the pacemaker maybe on the right side. So we don't want to do it directly over a pacemaker.
Right.
For other units, like for radial, you certainly can't do that on acute injuries, where on SoftWave you can do, like an acute injury is like a new injury. So stay away from that with radial, and some of the other focused only shockwave devices you don't utilize over total joints, whereas SoftWave really has a lot more uses in the fact that you can utilize it over those areas as well without any issues.
Right. Good. And then as far as, like, I don't know, maybe you can go through the top, I don't know, 5 or 6 great outcomes in terms of, like, if people are out there and they're thinking, I have knee issues or hip issues or back issues or whatever, what are some things if they're experiencing those pains that, you know, they might know that, okay, I might be a responder for shockwave?
Yeah, absolutely. So if it's a localized area of an issue, and that could be arthritis in your knee, shoulder, any kind of the itises, tendonitis, anything where you know that there's inflammation, you know, shockwave, SoftWave in particular has been the best thing that I've seen in my, 35 plus years of my career. It is amazing.
That's amazing, because you're only 40, right?
Yeah, exactly.
Yeah,
right. I started so young, so young. So when that inflammation or issue is just localized, it works well. I'll give an example of my knee. So I was at a wedding, and I talk about this in my book, The Pain-Free Formula. I was at a wedding, and I was over 50, and seriously, there should be warning signs at weddings for those who are over 50, because everybody gets injured, or at least every wedding that I've been to now, I see some sort of injury. But I was doing the polka with my son, and the beer barrel polka took me down. So I was trying to show him how to polka, and all of a sudden I heard a big pop in my knee. Fast forward, I couldn't walk on it, swelled up like crazy. I was able to come back to my clinic, do SoftWave on it. I was back to walking relatively normally within 3 treatments, so over about 2 weeks. But I still had some instability in my knee, and I wanted to know what that pop was. So I went to the doctor and got an x-ray, and thought we were going to have this beautiful discussion with colleagues about, what that pop was, what we could do, to in PT and all those types of things. And basically they looked at my x-ray and they said, well, we don't know what that pop was, but what we can offer you is a knee replacement or a cortisone injection. And I was like, whoa,
that's
whoa,
kind of, yeah.
I know. I was like, let's slow our roll here a little bit. I mean, come on. But what I learned from that is I looked at the x-rays, and I hadn't seen an x-ray of my knee since, 1986, when I had an ACL reconstruction. And the doctor at that time said, you're probably going to develop arthritis in this. I never had any pain in that knee up until that wedding. And, fast forward however many years that is. And what I learned is, looking at my knee full of arthritis, I'm like, wow, you can have arthritis and not have pain, right? So that really helped me understand that, a lot of patients, and I'll ask them today, I'll say, if you have arthritis in your, or if you have no pain in your joint that has arthritis in it, do you care if you have arthritis? And most of them are like, no.
Right.
I'm like, good. So with SoftWave, any type of those arthritis is, and I, use mine on a maintenance kind of probably every 9 or 10 weeks to continue to keep that inflammation at bay, so I don't feel it and I can be as active as I want to be. Clearly, you and I are biased in the fact that, we feel that exercise and all the other things that go with PT are really important, and they are, and helping me maintain that. But it really, so any joint that has arthritis, there's a very good chance of this improving it and significantly changing your ability to do what you want to do. Tendinitises are the same. When people develop tendinitis, there's usually some other biomechanical, or the way that they're moving maybe compensating for something else, or that's developed in this kind of overuse of tendons. So we can decrease that inflammation with those tendons. Again, any real part of the body with any musculoskeletal issue there. And then with physical therapy, getting you moving better, more efficiently, you're taking the stress or the trigger of the inflammation away so that you'll have long-term relief. Like I tell my patients, I love seeing you, but I don't want to see you for the rest of your life, right? I want us to correct the issue that continues to cause the irritation so that you can manage this on your own and don't have the pain, certainly not as often as you typically would. Low back can be tricky anytime that you're treating things, but this can be great to get deep into the low back muscles, deep into the little facet joints, which are on the vertebrae, those bones that stack up along the spine. And I can't get there with my hands, right? So this can get deep into those joints so that when we do our mobilization, our muscle energy, any type of adjustments, it's much more efficient for the patient and it's much less painful when we do those types of things. And then we again get the person moving better, maybe strengthen their core. It can also get to deep muscles of the hip, or there's a muscle called the psoas, which runs from the bottom of the ribs, kind of all the way to the front of the thigh. And that muscle can be a big issue because we sit a lot these days in front of, computers and things like we're doing now for hours on end sometimes, and that muscle can get shortened, which can lead to back pain. So getting SoftWave on there to bring more blood flow to that, and then us showing them stretches and then core strengthening type things and stabilization is really, really beneficial. Hip bursitis, hip arthritis, really, I mean, any joint, any muscle issue, you can, as long as it's localized, you can really move the needle with SoftWave.
And the key for that localized issue, I think, so people know, is there's oftentimes referred pain, right? Which is pain that's kind of emanating from somewhere else and maybe traveling in some way. And that pain's more hard to distinguish exactly what the source is, right? So maybe you have a knee pain that's kind of transient, comes and goes, and it's not very well localized. It could be coming from your back or your hip or something. So
exactly.
I think that's right.
And SoftWave is a nice tool to help to rule in or rule out some of those things.
Yes, definitely.
Because it can get deep enough into that tissue to help stimulate that, so we can see, okay, oh yeah, that is coming from the back and it's not coming from the knee itself.
Right.
So that's also important, utilizing it that way, and having a physical therapist that can discern, knows how you should move, or knows the special tests to do to discern whether it's coming from like the neck, it's going into the arm, or if it's coming from the shoulder. Like some of the neck patients that some of the patients who've had pain in their arm, I always would look at the neck before having SoftWave, which I still do. But now with SoftWave, which I had never been able to do before with my hands, there are some trigger points in the shoulder that create that pain down the arm, not just for rotator cuff, but all the way down to the arm and the hand even. And so now I can treat those with SoftWave to relieve some of that pain and also assess their neck and make sure that that's moving well.
Gotcha.
So it really helps expand my ability to differentially, diagnose or at least figure which structures are involved.
Maybe we can go into, so what's happening at, like, when you see, like, okay, you treat your knee, like, maybe give people a real dumbed down version of kind of like, how's that tissue changing that makes it feel better? Like, what's happening?
Yeah. So primarily the biggest thing is inflammation, right?
Okay.
So if something's getting irritated, let's say you have arthritis over the time frame, and they say you have bone on bone, or you've torn a meniscus or something like that, there's inflammation there. The body's trying to heal it. So inflammation isn't all bad. We need it in order to survive. But we don't want chronic inflammation, because with chronic inflammation, the body never is able to get to that healing resolution phase. So inflammation happens in 3 phases. If I scratch my hand, it gets red and puffy, and that's the pro-inflammatory phase. If I leave it alone and I take the trigger away, a couple days later, I'll see that it's not red anymore. It's maybe a little bit sore, but I can see that it's healing. That's moving into the anti-inflammatory phase. 2 weeks later, I look at my hand and there's no scratch there. That's the body's innate ability to heal. So what SoftWave does is it stimulates those anti-inflammatory molecules to go to that area to accelerate that healing process. It doesn't skip the pro-inflammatory process, which some of the things like NSAIDs and stuff do. They really dumb down that pro-inflammatory process, but and that then eventually slows our healing process over time when we use those medications too often. SoftWave is just stimulating and helping support and nudging the body from a pro-inflammatory phase into anti-inflammatory phase, and then the body itself does the rest. So that's the number one thing, is decreasing that inflammation. Some patients, as you know, come in with like a really, really tight muscle, or muscle that is just like hard as a rock, and that can contribute to pain in other places. So by bringing the blood flow, SoftWave brings blood flow to the area like immediately with the treatment. It's I have a massage therapist that comes to see me, and she's like, this is like a 2-hour massage in 10 minutes, but don't tell my
right.
clients that, right? So that muscle just can melt away, and that allows me then to get in there a little deeper without hurting the patient, and really work that muscle so it really has that blood flow. And muscles are red for a reason. They need a lot of blood flow to work efficiently and properly. So those are the two big ones that SoftWave does from a musculoskeletal point of view. And then there's some other factors with the immune system, it being antimicrobial treatment, all those types of things too.
Gotcha. Did you have a question too, Paul?
I did. I heard her story and I smiled, because it's the same thing I've experienced in others. You hurt your knee, you hurt your joint or whatever, and the first answer after x-rays is, let's replace it, or let's give it a shot. And I know today's episode is kind of tongue-in-cheek, called Moving the Needle on pain management. Why are so few people willing to move the needle out of pain management? Why is that the first choice and not the last choice for so many people?
Well, is that a rhetorical question? Or is that
I guess I'm setting you guys up to say that's what you do, but
Yeah.
so many of us experience that. You have pain, and the first thing you want to do is give you an injection.
Yeah, we want fast relief. We've been conditioned to stop listening to our bodies and to cover up the pain as soon as possible and to get rid of it as soon as possible. That helps certain industries, certainly, but in our industry, what Justin and I try to do is get that person moving better and listening to their bodies, right? Not just covering up the pain. I talk about that in the pain-free formula, is that pain is a message. It's a message that's telling us something. And if we try to listen and understand our bodies, we can move away from that trigger that's causing that pain, because the body's just trying to protect us. So if all we do is cover it up, it's like taking the batteries out of the smoke detector, right? The fire's still going to be there.
I love
but
that
you're
one,
not gonna
taking the
know about it.
batteries out of the smoke detector, yeah.
Yeah, exactly.
But you've done a lot of work in sports, and sports seems to be where a lot of this starts. I got to get a shot. You know, the old Joe Namath, I got to get a shot so I can get back out on the field here.
Yeah. Well, it used to be that it was only the athletes getting those shots, right? And it used to be that people were very concerned about getting those shots. And then it just became something that was more common and more common. And the cortisone injections, which now they know through research actually can create or be related to degeneration of the joint. So again, we think quick fix, okay, I'll feel better in the short term, but we're not really focused then on what it does to the joint in the long term. And that can be a big problem then, you know, if you're 35 and getting these shots, but then you're 65 and are so arthritic you can't move, you know.
Yep. Yeah. And as far as, you know, if we look at, you know, if someone's going to think about, oh, I've got these conditions, I want to go out and maybe get some, you know, SoftWave or something. Why would they choose to pay maybe cash for a SoftWave treatment versus if they're going to, you know, go and use their insurance just for, you know, maybe some normal PT or something like that?
Yeah, absolutely. And some of my patients still do the normal PT as well, and then come to me for SoftWave
Yeah,
only.
good combo. Yeah.
Yep, but I do SoftWave as well as PT for cash, and that's a great question. Why would they want to pay for it? If you look at the research, it's very clear. Sometimes it'll say something like in the conclusion that, you know, people usually just read the conclusion that shockwave and ultrasound both help, and, you know, they're both beneficial. So what is really making shockwave any better than ultrasound? Well, when you read the rest of the research, you see that there were 4 sessions of shockwave and 20 sessions of ultrasound. So what you're really getting for paying out of pocket is you're getting better faster, right? You're accelerating the healing process. So you really, in essence, a lot of times saving money, because a lot of people have these huge deductibles. And if they're, you know, going to PT that doesn't have SoftWave, they might, you know, have, you know, 10, 12, 14 sessions. I'll use plantar fasciitis, for example. I think I'm an pretty good PT, and it was taking me about 12 to 14 sessions for my patients to get better from plantar fasciitis, and I thought that was pretty good. Now I add SoftWave into it. By the third session, they're usually back to what they're doing. By the sixth session, they're usually completely fine when we've combined SoftWave with PT. So we're cutting that in half. I have a runner that was back to running 7 miles by the fourth session. Now, yep, I taught her how to tape so that she didn't trigger the pain again, but we were able to decrease that inflammation to such a point that she didn't have to sit around and wait for 3 months in order to get back to her sport. So if you want to get back to pickleball or want to get back to being active or picking up your grandkids faster, adding SoftWave to it, and if you pay out of pocket, it's just another way for you to get better faster.
Right. Yeah. And those lifestyle things are really important for people. And obviously exercise is important, as we know. So getting back to it is the best thing for our health.
Absolutely. Mental health and physical health.
Yeah,
sure.
Definitely. So looking in, I don't know, maybe into the future, what do you see as being some things that are, exciting on the frontiers of shockwave or softwave therapy?
Oh gosh, there's so much exciting. And it almost, before I understood shockwave and what it does, I was like, this can't work. This can't do everything that it says it can do. And now I'm like thinking every day about, oh my gosh, this could probably help with this and this could probably help with that. So a couple areas of research that I'm involved in is with pelvic floor research. We did a dyspareunia study, which is basically when in this particular instance, when women had painful intercourse. And again, that could be number of treatments for PT, pelvic PT for that. Easily 20 treatments. We're seeing significant improvement back to having, I wouldn't say pain less, but significantly less pain with intercourse at like 3 or 4 treatments. And then by 6 treatments, they're back to having pain-free intercourse. In many straightforward cases, certainly there's other cases that'll take a little bit longer. And even some like incontinence, or urgency as well, 1 to 3 sessions. And you accompany that with PT and they're back to normal.
That's amazing.
I hate to
I've been starting to use that, but I need to reach back out to you and talk through some of those treatment points for that.
Absolutely.
So that's great.
Yeah. And I hate to use this, but I will anyways. It's shocking how fast they how fast they get better.
Hey, use it. It's a time to use it.
Right.
And so let's see, we have a couple minutes here. I know you have your book coming out, and I'd be excited, I think, to have you, back on again to talk through that too, because as I read through, I actually bought the book. It's in the mail.
Awesome.
And I did because, as I read through, it wasn't just to support you, but also because as I read through a lot of the content, I saw that there are a lot of patients I have that, have maybe some of those bowel or, hormone type issues that I think I'm kind of missing the boat on in terms of giving them some valuable information. So I don't know if you want to take a few minutes to, discuss at least what people might find in that book and how that might help them as well.
Sure, absolutely. And the catalyst for me writing the book was that doctor's appointment that I had where when they said we can either do the joint replacement or cortisone injection, and I said no to both, and the doctor said to me, well, do you mind if I ask why you don't want the cortisone injection? Now, I was completely trying to be the patient, not trying to spout out any research or anything like that. But then I was sitting there thinking, well, she asked, right? So I don't think she looked at what my occupation was up until then. But I said, well, the research on cortisone says that, it could potentially degenerate my joint even further. And I said, if you look at my x-ray, like you pointed out, I'm already full of arthritis. Why would I want to do something that would increase that? And the doctor said, oh, you would need 100 of those shots to do that. And that I felt like my blood boiling at that point. I was like, how many people are hearing this, right? That the first thing you want to do is a knee replacement or joint replacement or cortisone, but they're not getting the right information to make their own choice. Now, I'm not against surgery. I'm not against medication, but what I am against is not giving people the information that they need to make the best choice for them. So that's why I really started the pain-free formula is, okay, let's talk about how conventional medicine right now treats pain, and it works for many people, but for the percentage that it doesn't work for, what can we do instead? I have a whole chapter on SoftWave therapy in there so that it can help people understand what it does, and if it's something that's right for them. I have a chapter on biomechanics and how we move and how that's extremely important to be able to address pain and keep pain away, right? And then I go into the things when it's not a localized issue, because when it's localized, biomechanics and use SoftWave therapy and manual therapy and PT is phenomenal. Like my plantar fasciitis program, 95% of the people get better and over their plantar fasciitis in a very short period of time. But when it's more of a systemic issue, like if they have a gut issue or if they have an autoimmune issue or if they have food sensitivities, all those things can also show up as joint and muscle pain. So I wanted to, if in my clinic, if by the third or fourth treatment, the patient's not 50 to 100% better, we're starting to look at hormone levels. We're starting to look at gut. We're starting to look at food sensitivity, because once they address those, that's systemic inflammation, because with SoftWave, we're kind of pouring out the localized inflammation. But if they have systemic inflammation from these other comorbidities, other health issues that they have, the body's just filling it back up. So we want to then look at how can we optimize hormone levels? How can we optimize gut health? And then food sensitivities are a big deal for patients. And it even was for me in my own personal experience of joint pain and muscle pain as well too. Remove those food sensitivities, work on the gut, start adding a couple of them back in if you really miss them. And then the joint pain and muscle pain significantly reduces. And then SoftWave at that time works extremely well, because now you have a localized issue versus a systemic one.
Yeah, that's a great issue. I'm sure I have a lot of patients that are in that category. And you talk about like, someone who doesn't know all the information about that, might recommend some, probiotics, prebiotics and stuff like that, and reduce processed foods. But getting to the specific food that might be a sensitive issue for them that's causing their inflammation is something that I think I haven't done. And maybe there's some do you have a recommendation for how people might go about finding out what they might be sensitive to or something? Or
there's a lot of food sensitivity tests out there, and a lot of them have been shown to be not really very accurate for food sensitivities, and the medical community doesn't really recognize the term food sensitivity. They recognize food allergy. So if I eat strawberries and I break out in hives, that's a food allergy, right? So that's an IgE response in our body. Whereas when the immune system responds more slowly to something, like for me, gluten was something that, I might be able to have a little bit of, but then if I had too much of it, I would get back pain with pain shooting down my leg. But originally I thought that was just from the bulging disc that I have in my back. So I still have the bulging disc, but I don't have the inflammation if I don't eat the gluten, so I don't have the pain and the experience. So I then lean more towards what the research is showing. There's a food sensitivity test that I use called the ALCAT. That's A as in apple, L as in Louisiana, C as in cat, A as in apple, T as in Tom. And that looks at 250 different foods through a blood test. They look at the white blood cells, which is a representation of our immune system. They expose those white blood cells from our own blood to the food. And if it reacts severely, if there's severe inflammation, moderate or minimal, it keeps track of that, or no inflammation at all. And that just helps patients go, okay, now I get it. Now I understand why when I had too much chocolate, my ankle aches, but they would have never put those two things together.
Right. Yeah.
In the first place. So it really just helps empower people to make the right choices for themselves.
Yeah, that sounds awesome. That's a great, sounds like a great resource that I think everybody could benefit from having. Well, I think that's a good spot to maybe wrap it up. I really appreciate you coming on, and maybe before you go, you can let people know where how they can find you, maybe your podcast, your book, your clinic as well.
Yep, great. Thanks for the opportunity. So my clinic's name is New You Health and Wellness, and I'm in Wauwatosa, Wisconsin, as Paul knows well, and Justin pronounced perfectly. And that is, we do telehealth as well as inpatient or in-person visits. My podcast is the same name of my book. It's the Pain Free Formula Podcast at the iTunes or Spotify or wherever you listen to podcasts. And then my book is on Amazon called The Pain Free Formula. Solving the puzzle of muscle and joint pain without surgery, drugs, or injections.
That's awesome. It's been great talking to you. You're always a wealth of knowledge, and I do want to have you back on to talk a little more in depth into your book and some of those topics there to help my listeners, get a better idea of maybe some things they can do for themselves nutritionally, and just simple life changes I think that all of us can do if we have the right information.
Absolutely.
So if you'll come back on, we'd love to have you.
Oh, I'd look forward to it.
Awesome.
And how do they reach you, Justin, if they want to follow up more information about this procedure?
Yeah, so we're at Physical in Lake Forest. It's FYZICAL. And the number there is 949-716-1800. Or you can find us online at physical.com/lake-forest.
Well, there you have it. One more reason to tune in. See if you can't make your health simplified with a simple guide to a healthier life. Right here in Orange County's only community radio station, OC Talk Radio, streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center.